welcome to this month's Thought Leaders Series sponsored by the Masters of Science program in Positive Organization Development and Change at Case Western Reserve University. Today's Thought Leader Series presentation is Appreciative Inquiry in a VUCA, Volatile, Uncertain, Complex, and Ambiguous World of Healthcare with Professor Ron Fry and our MPod, almost graduated MPod, Dr. Matt Barber. At this time, I'm going to turn our session over to Professor Fry to continue introductions and the presentation.
Thanks, Pat. Welcome, everyone. Before I introduce Matt just a little bit further, I wanted to say a few things about the title of the session and kind of build a context for us to listen and interact together on today. We're going to go through Matt's presentation, his story, and hold questions until the end. So please feel free to put questions into chat along the way, and or at the end, when we open it up, just use your hand emoji to raise your hand so we can try to get as many questions in as or observations and thoughts as possible. So just a word, our guest thought leader today, as Pat said, Matt Barber. He is the E.C. Hamlin Professor and Chair of the Department of OBGYN at the Duke University School of Medicine. He is in the current MPod cohort that will graduate this next month. And as part of his mastery learning portfolio, he had to create a project, an applied project. And so that's what he's going to be sharing with us today. The context, I just wanted to build a little bit of framing here. What we've been interested in our own research and in the coursework in the MPod program is this 70-30 notion that has been established in the social sciences around change leadership, change management, and the effectiveness of change programs overall. And the 70-30, if you haven't heard about it, is simply this consensus now from many different domains, mergers and acquisitions, re-engineering corporations, culture change projects, and so forth, that only about 28 to 30% of those change efforts are deemed successful by the leadership that initiated them. McKinsey began this study and conversation about a decade ago. And what we've seen in the literature is kind of a broadening agreement that it's tending to hold true. So one of the things that we believe, or at least we think is part of this, is that the dominant theories and methods of trying to bring about organization or system or community or supply chain changes and improvements essentially are getting bogged down because we're applying theories and methods that were validated 20, 30, 40, 50, 60 years ago, back to the middle of the last century. And so what might be new approaches, different approaches that could add to our toolkit or broaden our effectiveness as change leaders? And one of these, or one related idea, is that the pandemic kind of amplified conditions that surround our organizations, for-profit, not-for-profit, governmental, all of our organizations. And the idea of uncertainty, lack of predictability, fast changing conditions, crises, gave birth to this VUCA terminology: volatile, uncertain, complex, and ambiguous. And the notion here is that the dominant ideas we're using to approach change, innovation, improvement were based on assumptions about the environment around our organizations that are very, very different from what we actually experience today. And it's not just the pandemic. As I said, I think the pandemic amplified these conditions that have been with us for at least a decade, if not longer. So how might we bring about effective stakeholder engagement, effective collaboration and cooperative capacity, effective execution of good ideas, what constitutes positive change, and what might be some new methods and ideas. So one of those methods is appreciative inquiry, which many of you on the call have seen or you're familiar with. Some of you work with it. Matt used this as an application model for his project that he's going to talk about. And I think, again, in these particular times, it's a fair question for people to say, how useful can something called appreciative inquiry be in a context where we're experiencing so much angst, stress, disruption, divisiveness, etc. So we obviously believe that it is applicable. The story you're going to hear today validates that, and it validates it in the particular context of healthcare, which, again, before the pandemic, was already experiencing VUCA times. So with that, I'm going to stop and let Matt set up his slides and invite you into his journey. Matt, it's all yours.
Thank you, Ron. First, can you confirm you guys can see my slides?
Yes.
Okay. Well, first, I want to thank you, Professor Fry, and the rest of the MPOD program for the opportunity to present today, but more importantly, to learn these great skills and to be able to apply them. I think you will see that there are challenges in applying many of these change approaches, even in appreciative inquiry in today's times. But I believe that the things that I've learned in MPOD, and particularly this application, have not only helped me, but also to help the people that I have the privilege to lead. So I'm excited to share it with all of you. As Ron mentioned, I am the chair of the Department of OBGYN. I'll tell you a little bit more about the department in a second, but we had, would have been last summer. Department leadership were reflecting on the current state of affairs and realized that very profoundly that healthcare was in a crisis, particularly as it related to our department. So after over 3 years of the pandemic, nurses, physicians, frontline healthcare workers, essentially, frankly, were exhausted. And the Great Resignation is real and probably has affected healthcare more than any other sector. More than 20% of healthcare workers and almost 30% of nurses have left the field and are likely not coming back. 1 in 5 physicians and 2 in 5 nurses intend to leave over the next 2 years, according to some recent surveys. And some data that Ron shared with me, that 30% of nurses and social workers mid-pandemic met the diagnosis of post-traumatic stress disorder. Burnout rates in healthcare exceed 40%. And if you look at frontline, particularly high demand specialties like the emergency department, like obstetrics and gynecology, like the intensive care unit, burnout rates are as high as 60 to 70%. And that's today, even after the pandemic is winding its way down. Let me tell you a little bit more about our department. We are a academic health system, fortunate to be considered a premier OBGYN department in the country. We serve as a safety net for the people in the Triangle of North Carolina, so Raleigh, Durham, Chapel Hill, particularly Durham and the surrounding counties, but also a regional and national referral center for subspecialty care. We have now over 100 faculty, 40 or almost 50 now trainees, so residents and fellows, another 60 advanced practice providers, nurse practitioners, physician assistants, et cetera. We provide care at 7 hospitals and 25 clinics in the Triangle area, as well as 3 regional health departments. Last year, we delivered more than 7,000 babies, performed almost 6,000 surgeries, and provided care to almost 80,000 women. So it's a big spread out organization facing a very challenging time. The other thing that has been specifically a challenge is that we are growing. We're one of the fastest growing areas in the country, and we have grown the department to meet the demands of the local population. So we've probably added 40% to our workforce in the last 4 to 5 years, many of that during the pandemic. And because we are spread out and there's been so many new people, many had not met each other in person or gotten to know each other or built a connection to the department over this period of time. So one of the things that we talk about when we think about flourishing and thriving at work is having purpose. And in healthcare, we have inherent purpose in what we do. It's built into what we do. And I would say, in OBGYN, what we do is not just figuratively, but literally life-giving. And one would think that it's very easy to tie to that purpose and meaning, in spite of the challenges. But in spite of accomplishing some really amazing things in the past 3 years during the pandemic, our people were exhausted. They were burnt out. They were not connected together or even to the institution in many cases, and many had lost joy in work. We had a department executive team meeting last summer and asked the questions, how are our people doing and how are we doing? And realized that we were in a not the best state. We had already planned a department retreat in the fall. It was part of an update of a strategic plan. And we realized that a traditional strategic planning approach was not going to do it, given the current state of our people. We realized what we needed was something that would re-inspire, would renew, revitalize, would recreate a sense of shared purpose, and ideally design interventions, programs that would promote joy in work and individual and team thriving at a time when people, frankly, were burnt out. I had the privilege of having recently done the Appreciative Inquiry Practicum about 6 or 8 weeks earlier, and saw the profound impact it had, even in very difficult times, explained the approach to the rest of my leadership team, and as well as some of the background and data behind it. And we thought that this might be something that would make a lot more sense for us to do for our fall retreat than what we had traditionally planned. One of the things that helped convince people was that the data that exists about how AI is different in terms of a change management approach and how effective it can be relative to traditional change management or deficit-based approaches. As you all know, it's based on positive psychology. It builds on past successes and organizational strengths. I think one of the real things that I learned and appreciate from it is that it has this combination of being directed from the top down, but really is bottom up and grassroots. And from that brings a lot of new and powerful ideas and motivation that might not happen otherwise. It's highly participative. It nurtures a positive inner dialogue, stimulates vision and creativity, so is generative in itself. And what we have seen is that it really accelerates change because of the motivation that comes out of what we did, which was an Appreciative Inquiry Summit. The data, as Ron suggested, would suggest that AI shows as high as 70% effectiveness in change management as compared to traditional deficit-based change management programs, the classic burning platform, which may be is only 20 to 30% effective, as was mentioned. Looking at the data that exists, and again, the things that convinced my team that this was the right approach is data suggesting that AI summits particularly increase energy, commitment, and passion. They develop high levels of trust and mutual respect. They can create a magnetic work environment, and a pipeline of innovation that is accelerated even in difficult times, and data that suggests it dramatically cuts the cycle time of any change initiative. From all of these things, we decided to make our fall retreat an Appreciative Inquiry Summit. We had challenges, though, on how to implement this. As you likely know, a traditional Appreciative Inquiry Summit is done over 2 to 3 days. We have ongoing patient care demands, right? It's not like I can shut down all the clinics and the operating rooms. And what I certainly can't do is tell the babies to not come, right? So we have to figure out how are we going to hold a summit, include people across the organization in a way that's meaningful while continuing to provide ongoing care demands. So we decided to compress the summit into a single day. And we also had the goal of engaging as broad a group as we can, recognizing that many are skeptical of change efforts. They are burnt out and particularly skeptical of anything that's around wellness or flourishing, because a lot of programs have been put in place that have been shown, let's just say, didn't work or required additional work of people that really were Band-Aids. So with those challenges, with the guidance of Ron and others, our solution was to limit it to a single day summit. We could, in a single day, close our clinics and operating rooms. So made a point to make this day to minimize the care team that was required. So we basically left a skeleton crew to cover our various labor and deliveries and emergency room coverage. Particularly focusing on that skeleton crew being people, if possible, who we knew would be leaving the organization. We have a number of trainees who will be graduating in July. We have a number of faculty who we knew were retiring, and we asked them to participate and cover so that as many people as possible could participate on the day of the summit. And the critical decision we made was to conduct the discovery phase, the Appreciative Inquiry interviews, and the sense-making from that prior to the summit. So many of you are very familiar with the 4D cycle, and we followed this as part of our planning of the summit and conduct of the summit, discovering what our positive core is, what gives life to the organization, what are our strengths, in order to build on them, in order to dream what could be, to envision an ideal future, then design how we might co-construct how we might get to that ideal future, and then ultimately execute so that we can start to move the projects coming out of the summit towards something that would be sustaining and successful. When we looked at the steps of this summit, many of the things one would do prior to planning a summit, including defining the affirmative topic, identifying participants, developing the various interview questions, et cetera. We obviously did, as was typically planned. What we pivoted, as I mentioned before, is that we conducted the interviews and did the sense-making session from those interviews prior to the summit, and then had an abbreviated discovery phase, and then focused on dream and design during the one-day summit, and then put in processes in place in order to implement and iterate the projects that came out of that post-summit. The affirmative topic that we came up with from the core team was Duke OBGYN, a flourishing community where everyone is valued and can thrive. Each of the words in this affirmative topic were deliberate and really spoke to either the values that were in the department, building a community, which was the goal, and around the goals of the summit, which is to help to make a place where people feel included, valued, and have a joy in work and can feel like they are thriving and flourishing. The core team was made up of 9 members of my executive committee, so vice chairs, department administrator, and then we included an existing wellness committee within the department, which had broad representation across doctors, nurses, frontline staff, trainees, even some student input, and as well as the department's project manager. In terms of participating in the retreat, we included all the faculty, researchers, and advanced practice providers in the department, except for the small skeleton crew that would be covering during the day, the residents and fellows, nurse leadership, clinical administrators, and the department administrative staff, which altogether was more than 230 different participants. The next challenge we had was, how do we do 230 interviews in the weeks leading up to the summit and digest that information? And we chose, after considering a number of different approaches, to cascade our interviews. So we developed and refined and iterated a appreciative inquiry interview guide that was around 3 themes: thriving at work, providing extraordinary patient-centered care, and teamwork and community, and then also asked each of the participants to their vision of an ideal future. We specifically put together improbable pairs, people who might not have had a chance to meet each other or wouldn't normally work together in their day-to-day operations. Each of the core team was asked to interview 5 people. And at the end of each of those interviews, we asked, would you be willing, we asked each of the interviewees, would you be willing to conduct 2 to 3 interviews yourselves with other colleagues? In the end, we had many people volunteer, and we were able to conduct 230 interviews, each about 45 minutes, by 65 different people. That's 20 people from the core team, as well as another 45 who volunteered as part of the cascade process. And we did this over a 4-week period of time. You know, the one-on-ones were mostly done in person, but often in Zoom as well, and people were able to find time in their schedule where they could get together. So it ended up being a highly effective way to not only get the information we wanted from the interviews, but to begin to build buzz for the summit. Just by doing all these interviews, people started to talk about what we were doing and how this was different. In fact, I even was getting questions outside of the department. What are you doing over there in OBGYN? And people wanting to learn more. The other thing we did to kind of build community and to encourage people to do it is, when they completed their interviews, we gave them a brand new department t-shirt, which we encouraged them to wear at the summit. So it would kind of be a uniform, which you'll see in some of the pictures. It's a little token, but people really appreciated it. About a week before the summit was planned, which was this past November, we did our sense-making session, and we got the core team together for about 3 hours. We had over 130 pages of qualitative data from the interviews, which we split up into multiple teams, and together built our positive core. From that data, tried to abstract themes about what gives meaning to Duke OBGYN, what are our strengths, when are we at our best, the kind of things we want to preserve and build upon when thinking about the future. We also, so we had 6 different positive core themes that came out of that. We also developed aspiration statements, so provocative propositions that challenge or stretch or provoke the imagination about what an ideal future could be like. And we, between the sense-making session and the few days before the summit, developed and refined 6 different aspiration statements for the department based on the interviews that were conducted. This is just an example of one of the positive core themes and a few of the quotes that promoted it. We have each other's back and always rise to the occasion. And some of the quotes that supported this theme were, people show up in hard moments and no one shies away from the fire. We succeed during tough times because everyone is willing to be humble and learn together. Another one was, we thrive through high functioning teams. And the quote associated with this, we get to work with such talented and passionate people. When we collaborate, we can do almost anything. These were really inspiring quotes to hear and really neat to be able to put into themes to share back to people. The one that probably touched me the most was the theme around caring with compassion. And we were reminded that not only are we care providers, but we are also patients, even patients of ourselves. Everybody who delivers babies at Duke OBGYN, including my faculty, residents, and trainees, are cared for by people in the department. And one of the quotes that came out was, my care provider gave me something tremendously powerful. They showed me my own strength, which was touching. This was just one example of an aspiration statement that we put together, which I'll read to you. We put our people first. Duke OBGYN is a place where we see each other's hearts and know each other's faces. We take the opportunities to engage with the unique talents of each person brings to our growth and collaboration. Everyone on the team is seen as a valued care provider, regardless of their role. I know my department, they know me, and we can count on each other. We recognize, embrace, and nurtures people's unique strengths and talents by investing in their development. Because of this, Duke OB/GYN recruits and retains the best talent to provide the best care, patient care in the world. Easy to be inspired around statements like this. So this work led up to the retreat itself, which took place on November 2nd. It was held at an off-site historic building. The idea was very much to disconnect it from day-to-day clinical care. Tables were pre-assigned with mixed match pairs. We were at 30 tables of 8. All the materials, including a workbook, which was really critical to the success of the day, was available at the tables when people arrived. What we did to help people see back the information they shared with us about their positive core was we created a gallery walk that had all of the positive core themes and associated quotes and stories that went with those themes available as people walked into the event of the day. And you can get an idea of kind of what happened as people first walked in, registering and finding their tables. And we left about 25-30 minutes for this, and you really started to hear a buzz right away and an excitement. People started talking about what they were reading and enjoyed being together in person for the first time. We were at a place where we felt comfortable being together without masks. So many people, had not seen each other in this kind of close personal social connection in a very long time. So this was really a great way to kick off the summit. This was a broad agenda. The summit took place between 9 and 5:30 over this day. We, again, mentioned about 25 minutes was spent in the gallery walk, and then people were encouraged to get their seats. Really only 15 minutes of a welcome and introduction before we dove right into the various activities related to each of the portions of the 4D cycle. We started off really to kind of bring the positive emotional attractor into the room and build on the positive core with a video that had inspiring photos of members of the department interacting, celebrating, and working together through difficult times that was backed by some inspiring music. I then gave a very brief introductory remarks that kind of shared with people what we were doing for the day, what our goals were, as well as giving gratitude not only to the people who were covering clinical services, but also for everyone who participated in all of the interviews. It was purposefully kept very brief, and then we dug right in. And I actually, as the facilitator, really appreciated the fact that much of this was organic and didn't require high touch in terms of facilitation. I could be an active participant. We've started off really reinforcing the discovery phase that happens with the interviews themselves and through the gallery walk of the positive core by having the tables discuss when they had flourished recently. We then had members of the core team present the positive core themes and particularly tell stories that they heard during the interviews or that were heard during the interviews that you couldn't easily put on a poster board during the gallery walk. And then had various groups talk about their proudest proud moments and discovered a few additional themes of positive core that we built on throughout the day. We then moved into the dream phase to build upon the positive core to begin to dream an ideal future. We started by sharing the provocative or the aspiration statements that were developed prior to the summit. We then did 2 complementary activities where we asked the tables to bring their own dreams to life so that others in the room could see and share their excitement and hopes of what a flourishing community where everyone is valued and thrive really looks like. And we asked them to be creative and to come up with a 3 to 4 minute skit or other way of showing how we might make this the dream a reality. And I have to say, I did not realize we had so many creative people in the department. This was just probably the most fun and exciting part of the summit, was seeing everybody put these skits together, and it really brought together so many ideas that I would not have anticipated before the summit. In fact, at the end, we had an opportunity map where we put up 31 different change ideas that were developed at the tables, that all of which were fantastic. I probably could have predicted maybe 8 or 9 of them ahead of time. So this idea of generating new and creative ideas really did play itself out. We then used dot voting and selected 9 projects that we were going to move forward with to begin to design and take further after the summit. We then stopped working at tables and asked people to walk with their feet to the change idea that most resonated with them. And fortunately, we had a really good group go to each of the various 9 change opportunities. We had rearranged the room, put up, you can see whiteboards and other things to allow the teams to work together. And we asked each of them to begin to prepare. How would we move these ideas forward? They created their own 3-year aspiration statements, 1-year goals. They identified who were the stakeholders, both in the department and outside the department, and the support they would need to make these opportunities successful. They identified 2 team leads and 2 immediate next steps. I have I think it's a 4 to 5 minute video I would love to show you that gives you an idea of how the summit went and some of the things that came out of that. And on the other side of that video, I can talk a little bit about what happened and has happened post summit. And I have been really inspired not only by that day, but all of the work that's come since. So hopefully this video will play and you'll be able to hear it.
With the pandemic and as hard as everyone's been working with current staff shortages, I really felt we needed to do something that focused on our people and our teams and thought about how we can again refocus around a common shared vision for the future and to kind of renew and revitalize people in a way that would make them inspired so that we could move more towards a state where the department's thriving.
I definitely felt like my voice was heard today and that I got to contribute. The setup of having everybody at tables together to talk over ideas and then report out was really helpful in making it feel like a welcoming environment to share your perspectives.
The major goals for today's event was to really bring the whole department together. We have more than 220 people here, including physicians and nurses and administrators and researchers, all working together to try to really discover what our strengths are, to build and amplify those, to dream what the future that we want together is, and then start to plan how we would get to that future.
The biggest thing I'm taking away from today's event is that OBGYN department at Duke is really excited about patient care and ensuring that patient care remains at the center of everything that we do and ensuring that we are also doing that with our community in mind. It's not just a blind, we are trying to treat you and this is going to be the right way, but we are incorporating the values and the important features of our community in the healthcare that we provide.
One of my takeaways from today's event is that Duke OBGYN has an amazing teamwork atmosphere. We all do what we need to do to get things done. I really enjoyed the interview process that we did. It let me get to know different people in the department that I did not already know and meet different people.
The opportunities that I'm excited about were creating a float pool where we could have extra providers in a pool to be able to call on them to cover clinic, and it would really help with patient care and not having to reschedule patients, and I just think that would be a wonderful thing.
One of the really neat things about Appreciative Inquiry, which is the approach we use, is it involves taking time to interview the participants. So we actually had more than 200 people interviewed before the retreat, and we asked them things like, when have you had a time when you felt really valued in the work that you were doing, or what has been a high point moment where you felt really engaged? When have you felt like you've thrived, and what were the circumstances around those things? And by asking these kind of affirmative questions, it helped us to understand what are these ingredients, what are the strengths that we have that bring us together and lift us up and make us be successful.
So the day ended with a reception, which was fantastic after such an important and inspiring day. But then the hard part started, which was how do we support these 9 projects that were absolutely jump-started by the summit itself, but now we have to go and implement. So some of the things that we did was support each project team with an executive sponsor. We made sure we had 2 team leads so they could be supportive of each other and fill in when others might not be available. I also provided project management and administrative support to each of the 9 work teams. And then we planned purposefully our first meeting within 6 weeks of the retreat to build on the momentum. And the purpose of that meeting was to build a project charter, to develop action items and a timeline and a cadence of meetings, and then a protected time for the team to meet regularly to continue to do their work. There is a Michelle McQuaid in her book with David Cooperrider around the blueprint of change talks about another D, which is drum, which is the idea of embedding appreciative vitality and in order to keep momentum going and support the long-term change of the various projects that come out of a retreat. So some of the things we have done, as you saw in this, is we've captured video and photos during the retreat, which we've used as collateral for ongoing updates. We have made a point to put small wins and progress in department e-newsletters and celebrate them at faculty meetings and other areas that we can. We are now just about 6 months, a little over 6 months from the retreat, and I plan a 6-month status report, which there's going to be a lot to share in the coming weeks. We have meetings upcoming with the project leads to be together to share wins and lessons learned of the various things. To give you some idea of where we are, one of the things that happened right after the meeting is we realized that our compensation plan was not aligned with the other things that we were trying and promoting in terms of incentives, the other things we were trying to do that came out of the retreat. So we added a 10th project, which was to update our compensation plan that would to support the kinds of things outside of clinical care that we still are an important part of the missions of the department. So then we now have 10 projects. Of those, though, we've had considerable success. We already have 1 project that has achieved its objective, an important one around child care support during times of illness. We've launched pilot initiatives or had a critical deliverable or 1 or more critical deliverables that come out of 3 of the various projects. 3 other projects are currently on track to meet their goals. We have 1 that has been delayed because it's awaiting a critical dependency and will start to pick up its work in the next month or two. We had one project learn that what they were planning is likely not feasible, and so have pivoted along the same theme. And then we have one of the 10 projects that has had no progress and is at risk of failure, and likely will either be mothballed or stopped here shortly. That is the story thus far of my summit. I will just say before we open it up to questions that it has been a fantastic experience. I have learned a ton. And that the Appreciative Inquiry approach and the Appreciative Inquiry Summit itself, without a doubt, was an accelerator. You know, it helped to generate ideas that leadership would not have thought of. It built because it came from the bottom up. The motivation and support around the projects that came out of it were almost built in. They were, and the ownership is really held across the entire 230 people and more who participated. And during that day, we got a lot of work done starting to plan projects. The hard work has since happened, but I think we're building on a ton of motivation that is going to help move a lot of these projects forward. And I think, Ron, with that, I will stop sharing my screen and open it up to any questions.
Super, Matt. Thank you. Let's just, if you've got your hand emoji you want to raise, or we can just try to kind of popcorn around. Just unmute and speak up if you've got a question for Matt. Okay. So there's one here, Matt. Oh, there's two already. So Susan, why don't you unmute and give your question? Susan Duff.
Sure. Hi, Dr. Barber. Awesome presentation. I've worked in healthcare for many years in administration, so this is fabulous. So my question is just really a point of clarification on the process, and I love this new twist. Is that what I heard was that the core committee that conducted the interviews created aspiration statements before the retreat, and then there were more aspiration statements created at the tables during the retreat. And so I just wanted some clarification.
Sure.
It seems like a lot of aspiration statements.
Yeah, so the aspiration statements created by the core team before the retreat were really about what is an ideal future for the department. The aspiration statements that came during the retreat were what is the goal of the various projects that were developed as part of the dream phase, right? So we had aspiration statements for each of the 9 projects really as mission statements or vision statements for those individual projects. I will tell you that whether it's part of officially of Appreciative Inquiry in the future or not, I'm going to use aspiration statements for it. I think they're way better than vision statements, or a better version of vision statements, in my opinion, and have got a lot more people enthusiastic about where we're headed. And so we've added this to our kind of project charter for anything that we start with going forward.
Awesome. Thank you.
Sarah, you had one. Sarah Spangler.
Yes.
There you are. Hi, Sarah.
This was a wonderful story. You talked at the beginning about the high levels of burnout, exhaustion, and I was curious about whether that shifted as a result of this process. I would imagine it did, but I don't want to assume. Yeah. And have you measured that in some way?
So I would say anecdotally, it absolutely did. I mean, there was much more enthusiasm about the future and a concept of a shared vision of the future that didn't exist with the current group beforehand. I do not have specific pre and post measures yet. We do have measures of burnout that the healthcare system does periodically, one that was done about a week after the summit. So I'll be able to see over the next year, at least if these projects have started to make a dent there. Now, recognizing there's a lot of other things that are still playing into that, right? And us having to learn how to transform healthcare with fewer people providing it is a big part of that. But I can say without a doubt, anecdotally, there's been changes in terms of qualitatively. That's something that you might publish in a result. I don't have those results yet.
Okay, great, thank you.
Was there I thought I saw a hand from Durga.
It looks like
No.
Mr. Ward.
Okay, good. Go
Yep.
ahead, Alexander.
Thank you. Thank you so much. Two questions, actually. You started the presentation, by the way, exceptional work. You started the presentation with the concept of VUCA. Did you ever tie what you were angling at, whether it was volatile, uncertain, complexity, ambiguous, back to the work of the appreciative inquiry, or was that just used as a framework? That's the first question.
Yeah, it was used as a framework of why we were doing this now, that we were in this situation and we needed an anchor to hold on to and a vision together of where we needed to be. But in terms of the interview questions themselves, it was not around VUCA specifically. It was really about the bringing purpose and meaning and thriving at work within the department.
Second question, as I'm exploring currently with some of my own clients in the healthcare systems, how would you see this particular appreciative inquiry process supplementing or complementing population health or health equity kinds of concerns?
I think it would have great application there. I mean, my limited understanding of all of the applications of appreciative inquiry, particularly where Professor Cooper Ryder and other going is about bringing community some of those things together. And you could see the whole being a much bigger group, right? The healthcare providers, the community they're working in, the patients themselves as part of an appreciative inquiry summit to begin to think about improving health in a local community, for instance, or in a population. I think it'd be a great application. I would love to see it. People do it. Maybe it's happened and I just don't know. But
well, I'm certainly in the process of doing that now, which is why I asked. And this presentation, I know it's being recorded, but will it be available? I know it's a part of your research, your academic research work, but will it be available as well?
You mean the slide presentation?
The slide presentation along with this this work here.
I think so.
Yeah, I mean, certainly the recording of this is, and I'm happy if you want to go through Pat to get people any of the materials that we used. I mean, they're not proprietary in any way. I'd love to see this spread. So,
well,
okay, let's move to Duncan. Can you? There you go.
There you go. Okay. Hi, Ron. It's nice to see you. Let's see, just a quick process question. The pre-summit interviews. So backing up, the aspiration statements, you said there were some made by the core team ahead of time and then during the retreat. Those ones that were made by the core team, were those informed? Forgive me if you answered this already. Were those informed by the pre-summit interviews?
Oh, sure. Yes. So
Okay.
the interviews were done about 5 weeks before the summit. So a 4-week period. And then about a week before the summit, the core team got together and built the positive core themes as well as those initial aspiration statements. And surprisingly, we're able to pull it together in about 3 hours with some iteration afterwards and refinement. But we needed to get the material enough time to be put up on boards and put into the workbook and things like that, that we did it about a week beforehand.
Great. Thank you so much.
Durga, I think you were up first and then Jane, and then we'll probably have to close after that.
Okay, please. Okay, that's a great presentation, Dr. Barber. My first question is, OBGYN is like a very high functioning itself, especially you did compare the critical care and emergency room. They're all to begin with very high functioning team. But how about when it translates to primary care? Because we have more mixed bag when it comes to primary care. People come with like different, work ethics, and I'm just curious to get your opinion.
It's a great question, and I don't know that I have an answer for you. You are right. We have to work in teams all the time on labor and delivery in the operating room, et cetera. We also provide primary care clinic, and many of the people in our team don't work on labor and delivery or in the operating room. So I think we have OBGYN is one of the unique specialties where there's kind of a mix of everything. But I can't answer your question specifically. Would a primary care team see this as a differently or react differently than our team? My guess is they would. I think it would still be valuable, but Ron may have some other insights there. I know he's worked with an emergency department, but again, that would be very similar to what we're doing.
Good. Jane?
Yes, can you hear me okay?
Yep. There's an echo.
Let me just get rid of that echo. Okay, how's that?
Better.
I can't thank you enough, Matt, for your, I mean, I was just picturing you as a leader in the hospital, having the desire to come to do this program to benefit your organization, putting in the time and work on top of everything else. This presentation was phenomenal today. I'm, by the way, a doctoral student of Ron Fry's. So I am studying also with David Cooperrider, and Appreciative Inquiry is part of my study. So I'm just on so many levels. My husband's a physician and in administration, so I'm thinking for him and, you know, all the other healthcare administrators out there. This is a phenomenal message, and I do management consulting. I'm thinking, okay, how can I better help leaders? So my question is, have you looked at possibly making available kind of your process? I know there's a company called Clark. They do aquatic and mosquito control, and they put together a white paper called Making AI Stick. And I don't know if you've seen that or not. I'm happy to send it to you, but have you thought about putting something together? And if you're willing, I'm happy to help you. So let me know if that's something you'd be interested in.
I have thought about it, but have not had the time to do so yet. And you know, obviously, there's a lot of work here. I think a lot of people could benefit. Even within my own institution, I've started to have people come and ask me about what we did, and to begin to share those things. But have not seen the paper by Clark. Would happy to see it and happy to talk more. I think this has been first of all, thank you for your compliment initially. This has been an incredible learning experience to me. I am without a doubt a better leader because of this program.
That's fantastic. That's fantastic. Well, thank you so much. I can't thank you enough. It looks like actually my video went off, but here I am. I had two videos open, but just so you can see, and I'll reach out to you. I'll send that white paper, and just thank you so much for everything.
Ron, I see you have one. If you don't mind, and if you can stay just past the hour, we can stay on to try to field your question. I do want to take the last 2 or 3 minutes here. And
Ron, I just want to point out that Earl also has had his hand up for quite some time, so I'd be happy to stay after for a minute or two if he wants.
Thank you. I didn't see Earl's on my gallery here. Okay, good. I just wanted to end with a few broad observations, maybe partly to Durga's question about applications elsewhere, and then turn it over to Pat Petty for just some closing remarks. So the only thing I want to add on as a kind of capstone to this, in terms of building cooperative capacity with any group of stakeholders around any potential topic, meaning change topic or improvement or innovation topic, there's at least 3 things in this story that we see over and over, I think, as so-called best practices. So the first one is connecting the stakeholders from strengths. In other words, starting with what is it that's already giving life? What is it that's already helping us be at our best when we're at our best? Not starting with a problem diagnosis. And when you do that, 3 things are guaranteed. Engagement goes up, the experience of positive affect goes up, and the 2 of those things combined helps people see the future differently immediately. The same person, if they start with a connection to shared strengths, them and others, will immediately see more possibilities in the future. So it's a very, very strong leverage point to start with strengths and then connect through stories. The initial interviews pre-summit started with story sharing, not with, list questions. Tell me 3 things you think will help us decrease burnout or deal with burnout or something like that. They started with stories, and then again in the summit, they began with stories. And the more you can spread those system-wide, multiple stakeholders, then the stronger foundation for change. And then finally, you connect from strengths, connect through stories, and connect for purpose. It's about enabling things. It's not about fixing things. That sounds very simple, but it's actually extremely important, what we're finding as a success factor. So I want to thank Matt again for not just your story, but who you are as a leader, and appreciate your sharing with us. And Pat, I'd like to turn it over to you for some last comments.
Thanks, Ron. With respect to everyone's time, we will formally close today's session. But this session has been recorded, so look for an email from me with the link so you can watch it again, and also feel free to share with others. Also watch for our new monthly newsletter, Thought Leader Insights, where we will continue this conversation with Matt and Ron on this subject. My sincerest thanks to both Matt and Ron for presenting another inspiring webinar in the Thought Leader series. After hearing about Matt's project, I have been asked by Ron to offer anyone interested in applying to the MPOD program the opportunity to receive a $5,000 scholarship in Ron's name. All you need to do is apply and be accepted into the program for this consideration. And I have provided our contact information and the link to our website and application link in the chat room for those who are interested. I also want to thank all of you for coming today, and I want to invite you back for our next Thought Leaders Series webinar on June 5th, when MPOD faculty Diana Villamoria will talk about advancing women leaders. Thank you, and as I said, I'll send you a recording as soon as possible, and I'm going to turn it back over to Ron and Matt for any further questions, and let them close it when they're ready.
Okay, Pat, thank you. Thanks everybody for joining us. We really appreciate the opportunity to be with you and continue this series. So there were some other questions. Matt, did you remember? You said Eric?
It was Earl.
Earl, thank you. Sorry. Is Earl still with us?
Yes.
There you are,
I'm
Earl.
here.
Okay, good. I see you. I see you. Go ahead.
Okay. It sounds like from the aspiration statements that were developed, helped keep the summit on track from the perspective of when entering the discovery phase, that if people are stuck in a deficit-based situation, that they have trouble dreaming. It sounds like this pre-work really helped keep people optimistic about not only the summit, but the action items that were to come after that. Would you say that that was really key to helping to keep everybody positive as they entered in through the summit?
Yeah, particularly the positive core, the kind of gallery walk with all of the story, that really was a great way to start. And I'm going to thank Ron for the suggestion, because people could see their own quotes and stories reflected back on them, right? And or learn about other ones that were shared. And it began to start a conversation. You could hear it, the buzz, people talking about, you know, how much it validated their own feelings or other spins they had on it. I think that was really helpful. And then as we presented that positive core, some of the stories around it, and then later in the dream phase, to hear the aspiration statements that we got from the data you shared with us, and again, mirroring it back to them, was a really great way to accelerate that process, I thought.
Great, thank you.
Ron, you were there when I had to close the session. Go ahead.
A couple of quick questions. One is you talked about the importance of language. And what did you say at the end? Something that you changed dream into aspire? Was that your choice?
I said vision statement into aspiration statements in the same way that we talked about that Ron and David teach about aspiration statements as part of the dream phase. Really a paragraph that talks about a provocative, positive future.
Well, in terms of that, was that explained in like a workbook that you said everybody had at their table? Is that available?
Yes. And again, if you want to reach out through Pat, I'm happy to share any of the materials, including the workbook.
Okay, thank you. And the last question, I hate to ask, but did you have a budget for this and how expensive was it?
So fortunately, not only was I the facilitator, but I was the sponsor, right? And we did have a budget because as the chair of the department. The expense of the summit itself was mostly the location, because the rest of it was all done internally. And we have a great communications team already in the department that built the workbook and the collaterals. The real expense, honestly, though, was the opportunity cost of closing down 25 clinics and not operating for a day. Yeah. But honestly, given where the department was at the time, and even is today and has been for the last few years, it was worth it.
Yeah. The last question, are you going to do it again next year? Would you do it the same kind of program again?
No, I think next year's too soon to do all of this again. I think there will be opportunity for us to get together and talk about progress and of the projects that came out of the summit and what we've learned from those and where we might go from there. But to do this, I wouldn't want to rebuild all of the work that we're already starting, because some of it's going to take a few years to mature.
Okay. Thanks very much, Matt. Great story. Thanks, Ron.
Thanks, Ron. Jane, do you have another one?
I do not. And so I'll put my hand down, but just thank you. Thank you very much.
Right. You're welcome. Anyone else who's still with us? Other questions or comments?
Matt, your rapid prototyping and your the 9 and the 10 that came out. Where are you in that phase now? And you said that you actually mothballed one of those.
So one of them is either going to be mothballed or killed. One of them has accomplished its goal already. So it's the project that we envisioned has happened and is now implemented. We've got 3 that have had deliverables or some real wins that we've been able to share, but are still along their progress. Another 3 that are on track, given where their goals are. And then another one that's had to pivot because what we originally envisioned, they realized wasn't feasible. And they said they've stayed with the theme, but gone to a different approach.
And so you've got a small group of folks who are monitoring the success of those and documenting those metrics.
Yeah, and that small group is the executive team. And I have a single project manager that's supporting all of these teams. So she's really making sure that we understand where everything's going and where who's making progress and who's not, and how we can help them.
Fantastic. I'd love to reach out to you individually on LinkedIn as well.
Yeah, I'm not on LinkedIn, but again, Pat can get you my email.
Oh, fantastic. Thank you.
Okay, anyone else? If not, we'll respect everybody's time. Thank you again for coming, listening, joining in. We look forward to seeing you in our next monthly contribution in this series. All right. Everybody have a great day. Take care. All right. Bye-bye. Thanks, Matt.
Thank you.